One, this is Christian, part of the Grit Health team, a team that's made up of cancer patients, survivors, and caregivers, as well as healthcare professionals. Today, wanted to give the Grit Health perspective on when you receive that new diagnosis of a cancer diagnosis. So when you hear those words, you have cancer. So the first thing is try not to freak out. I know that's really tough. Everyone's going to freak out. You're likely going to freak out even if you hear this. But looking back on it in my own unique perspective, as well as talking with other team members, you're going to freak out, but try to lessen that freak out. There are ways that you can try not to. We have some resources available at our own website, such as Vivibot, a mental health chatbot that walks you through some exercises and lessons to help you when it comes to improving your mental health after a cancer diagnosis. But no, yes, things are going to change. Yes, humans don't like change, but try not to freak out as much as possible. Secondly, try to establish a support system. If you're someone that doesn't really like asking for help, it's time for you to get past that and start seeking out some of those trusted friends or family members that you do want to ask for help, because you're going to need help. Things like doing chores around your residence, things like childcare, maybe even people picking up food or preparing meals for you. You're going to want help, and you need to be okay with asking for that help. So start establishing who those individuals are and getting your support system in place. Third, start thinking about finances. So cancer treatment in America is expensive, right? You're going to receive some bills in the mail that are going to shock you in terms of the actual bill amount, right? Know that some institutions, a large amount of them, in fact, work with you to take that final amount and actually make it a little bit more manageable in terms of monthly payments. Don't be afraid to call and just start asking those questions. A lot of them are willing to work with you with either low or no interest when it comes to those monthly payments. So when you receive those bills, know that it's not something you need to scrounge up money for today, but give the institution a call and see if you can get on some kind of manageable monthly payment plan to start paying it off over time. Lastly, if you have the time, look into a second opinion. A second opinion isn't seen as a bad thing for that oncologist that diagnosed you. It validates that diagnosis. It validates it also for you, which is also a great thing, right? So if you have the time, look into some other cancer doctors in your area and see if that's something that you have the time to be able to have a second opinion made on your cancer diagnosis. We hope this was helpful. If you have any questions or comments, in the description of this video, we're going to link to the resource that this newly diagnosed content is on. We're always looking for input from others as far as what helped them. So if you do have any input, we would love to hear it. You can look for Grit Health and all those social media channels that you all know and love, or you can even email me specifically. So that's christian@grithealth.com. Thank you, and we'll talk to you soon.